So Ben Olken and Sudarno Sumarto, who are up next, exemplify the long-lasting intensive partnerships we've been talking about today. They started working together back in 2001 when Ben Olken was a graduate student and Sudarno was running SMERU, one of the leading independent economic and social policy think tank in Indonesia. It's therefore appropriate that they're going to do a joint presentation. Ben is now, as you've heard, a professor at MIT and director of JPAL. Sudarno is advisor to 2NP2K in the Office of the Vice President of Indonesia. They will jointly talk about their most recent collaboration. Ben and Sudarno.
Good afternoon, everyone. First of all, I would like to congratulate JPAL for its 10th anniversary, and thanks for kindly inviting me to this celebration. And longtime friend and colleague, and I would like to share our story about how we have demonstrated that rigorous evidence and real politics can coexist. As many of you know, that we have heard from even in developed countries, that many social assistance programs oftentimes are not implemented according to the intended plan. Corruption, idiosyncratic flaws, lack of governance often impede the delivery of social assistance such as cash transfer, help from the poor, as well as subsidized food, for example. So, as we all know, and as you can imagine, this occurs in a country like Indonesia, very diverse culturally and also geographically, with very decentralized governance structure. Again, this backdrop, the government of Indonesia has been working to develop the existing policy and also to amend, to improve the way how we do things, especially in delivering social assistance using rigorous evidence. So here's where the story began. Indonesia spent about, on average, yearly 1.5 billion. This year we spent actually even more, about $2 billion US per year for a program called Raskin. It is subsidized rice intended to help the poor to cope with the food shortages. It is the largest social assistance in Indonesia. More than half of our social assistance budget actually goes to Raskin. Yet, while the eligible households are supposed to receive 15 kilograms of rice per month at the price of about 1,600, about 1.6 US dollar per kilo, in reality, they receive on average over the last decade is about 5 kilograms per kilo and paying much higher price, about 2,400. In other words, they are receiving about 30% of their entitlement. There are many possible explanations. One of them is probably that the people in charge of the rice distribution redistributing it to non-eligibilities and charging markup price. Only in the spring last year, the government of Indonesia began to explore reform on Raskin for the first time since it was introduced in 1998 in this one of the crisis. So what we had in mind at that time was actually under the Vice President of which we have the, Abdul mentioned in his opening about TNP2K, National Team for the Acceleration of Poverty Reduction, chaired by the Vice President. The team proposed to reform Raskin by introducing ID card. Why ID card? Because we thought that it could empower poor households to demand their full subsidy that they are entitled. Secondly, the card will also give distributor an easy way to verify if households are eligible. And then in April last year, after some deliberation, consultation with the line agencies, the team presented to the Vice President during a limited cabinet meeting. The Vice President appreciated, of course, he's a very smart and nice guy. And at the end, he agreed that we needed rigorous evidence for this approach efficacy before rolling out ID card nationwide. He wanted to know two evidence before he agreed to roll out nationally. The first evidence he would like to know is, do ID cards make a difference? Do they make a difference in terms of improving the allotment of the poor in receiving Raskin? The second question I would like to know is, will the ID card have unintended consequences? Will it create conflict? Soon after that meeting, we discussed among ourselves, and I happen to have a good friend from JPL, Ben Olken. Rachel mentioned I knew him when he was a little boy in SMERU, Harvard graduate, doing his dissertation at Harvard, working with me about 10 years ago. And, but the problem is, I was in Jakarta, Ben and a JPL colleague, Abhijit Banerjee, Rimahana, and also Jaron Kaila here in Boston. So what we did was Skype, and I told them about this meeting with the vice president, and he needed help to see if this card idea actually working. After back and forth discussing, recognizing the importance of this is a government priority, we agreed that it was a worthwhile project to pursue. Further, it also will provide a more innovative way of looking at not just card, but also looking at the delivery system by introducing the participation of the private sector of the community in distributing rice from the distribution point of the household. The request from the vice president is very important that we have to get this evaluation done in December 2013 if it will have an impact if card is really working, simply because this has something to do with our budget cycle, and also this is a political cycle for the government to have an impact of the intervention. Next year is going to be the end of the SBY presidency. We'd like to have an impact. And in fact, we only have that 8 months. We only have 8 months from May until the end of last year to have an evidence if this is really working. So now I would like to, in this 8 months, in terms of this very tight schedule, how we do it, now I would like to invite again my colleague, Ben, to tell us how did we do it as a team.
Thanks, Pak Darno. So as Pak Darno mentioned, there were 2 key questions that were posed to us by the vice president. The first was, would the ID cards actually work? Would they make a difference? And the second, and I think this echoes some of the comments we heard in the panel before about issues about downsides, is would they cause social unrest? Right? Would the, if the money was being transferred to ineligible households, if the ID cards came and money went back to the eligibles, maybe the ineligible households would protest, and I think the political system was very worried about that. So these were questions that were of very strong interest to the policy community. But they also helped us and our team answer questions that were more of academic interest about the impact of transparency. And so not only do we want to answer these questions, but we wanted to understand, did increased transparency about who was entitled to the program make a difference? And if so, what were the mechanisms through which that happened? Now, it turned out at the same time that TMP Duoka was thinking about should we do the cards, there were also a myriad of questions about how we should actually design the cards, how they should be implemented. There were many things. And so working with Pak Darno and his team, we developed a series of interventions along at the same time, which would help us understand not just did the cards work on average, but if so, why and how they could work more effectively. So for example, we were interested in the question of, should we just give out cards to individual stakeholders, or was it important to post a list publicly and give public information so that people would know not only that I got a card, but everyone else got a card as well? That was a practical policy question, but also an interesting academic question about the difference between private knowledge and common knowledge. A second thing we investigated was whether we should have coupons on the cards or non-coupons. Coupons might increase the bargaining power of the village heads against the ineligible households by basically saying, look, you don't have a coupon, I have to give the coupon to someone in Jakarta. Maybe that might help make it easier for them to implement. A third thing, to investigate the impact of information per se, we did 2 versions of the cards, one with information about the copay price printed, and one with information without the copay price printed. That helped us exactly answer the precise question of would increased information work in a very precise way. And finally, to test whether having a card in hand made a difference to an individual, we also randomized whether the card should go to everyone in the village who was eligible, or only for the bottom 10% of the very poorest, who were the main focus of the government. So as you can imagine, there was 4 different variants. There were 2 to the 4th or 16 possible combinations. Villagers were randomized into one of those 16 cells or a control group. Now, I don't have time to tell you in my remaining few minutes what all the different impacts of all those different cells were, but just to share with you, we did find that overall, compared to the controls, the cards made a difference. They made a difference in increased the amount of subsidy that the eligible households were getting by about 20 to 25%, compared to controls, and there was no decline for the ineligible households. It looked like a reduction in leakage from the program. So I think this was very encouraging. Now, one reason I think this was actually persuasive in the policy debate was because this was obviously a randomized trial, we could show our colleagues in the government that not only did they see an impact comparing treatment and control after the cards went out, but if you looked in the same villages at baseline, there was no difference at all across those villages. And I think showing that there was no difference at baseline, there was balance, but there was a difference ex post really increased the degree to with which it was persuasive. And finally, echoing some of the comments before about how important it is to be timely. As Sudarno mentioned, there was a really tight timeline here. So from the time we got the vice president's initial request, that was in April of 2012, we had to deliver preliminary results 8 months later, in December of 2012. And luckily, I think because of the stars of policy alignment, a tremendous amount of hard work from our entire team, and the availability of funding from our partners at AusAid, we were able to actually deliver results in time by December in order to feed it to the policy process. So to tell you how that actually worked in the policy process, I'll pass it back to Sudarno.
Thank you very much again, Ben. So basically, getting the preliminary result in December was very important, critically important for the vice president to decide if this ID card is actually going to work. So we convinced them with the evidence. I remember vividly one of our colleagues, JPL here, Hector Salasala, we discussed about how to present it to the vice president through the executive director of Bambang Widianto. Thus in June 2013, only 6 months after the preliminary finding, the government are fully committed to introduce this ID card for covering about 15.5 million households, this involving about close to 65 million individuals. So you can imagine how big is this program. And the beneficiary is not only entitled to Raskin, but also at the same time we introduced the scholarship from the poor called the PSM and also the unconditional cash transfer for 4 months. And by the 3rd week of August this year, more than about 14.5 million households is already in the hand of the eligible household. So I would like to close this talk. This is the card that I just mentioned, by just the takeaway message of how this collaboration has been so effective from my point of view. The first question was, why was evidence used to improve nationwide scale-up of ID card? I think the government of Indonesia, as the President SBY himself mentioned during the video, that evidence-based policy making has been continued to be adopted in Indonesia, not only to improve the existing policy, but also the next generation of social assistance. We heard from Karthik about using the electronic ID, for example. And indeed that we need to and are committed to ensuring that our policy actually benefited the poor as much as possible and do not generate negative unintended consequences. And finally, why was the partnership so important? I think the critical ingredient is that we achieved this by discussing from the beginning partnership with the researchers from the start. And combined with their ability, research capacity, and the willingness of government to engage, it makes this different. And finally, the partnership did not yet end here, as I just mentioned at the beginning, that we are also testing about innovative changes in engaging community to deliver rice. So it's not going to be government monopoly, but also involving local community to make it more efficient. So we don't know the result yet. The team is still now on the ground, and we'll report to you in the next conference. So we would like to end our presentation with showing a video about how we socialize this card in the communities, also based on what JPL already did during the Raskin card trial.
Masih banyak rakyat Indonesia yang hidup di garis kemiskinan. Karenanya, pemerintah Indonesia memberikan Kartu Perlindungan Sosial atau KPS kepada rakyat miskin tanpa dipungut biaya, yang dapat digunakan untuk mendapatkan bantuan-bantuan seperti Raskin, BSM, bantuan siswa miskin, BLSM, bantuan langsung sementara masyarakat. Bila Anda adalah orang yang termasuk tidak berhak menerima Kartu Perlindungan Sosial, atau petugas Pos Indonesia tidak berhasil mengantarkan KPS, maka KPS harus dikembalikan. Setelah itu akan ditentukan rumah tangga miskin pengganti pada musyawarah desa. agar bantuan dapat benar-benar diterima oleh yang berhak. Jadi, ingatlah, kartu perlindungan sosial hanya untuk yang miskin. Pesan ini disampaikan oleh